I'm here with Dave again from NYC Pain MD, and today he's going to talk about something he hasn't talked about with me yet: rheumatoid arthritis. And a lot of people don't know NYC Pain MD has some treatments to help this. So I'm going to let Dave take it away here.
Right, right. So, Brad, yeah, thanks for hosting this today. Rheumatoid arthritis, it's a lot different than osteoarthritis. Just to review that, osteoarthritis is local wear and tear of a joint, basically a drying out, if you will, where the knee joint, the cells that line it, called synoviocytes, stop producing lubricant. And of course, famously, we have image precision guided ways to add lubricant, and that works in the majority of cases to reduce pain modestly to significantly and manage to keep that patient out of surgery in many cases. There's another type of arthritis that exists called rheumatoid arthritis, or sometimes for short, RA. Now, there's a lot of commercials on TV for Enbrel and Humira and other biologicals that are treated for what they call the systemic part of rheumatoid arthritis. What does that mean? Systemic means it's all over your body. It's not local like wear and tear osteoarthritis. Rheumatoid arthritis, keep in mind, I want to keep this simple, and I am not a physician. I'm a patient care coordinator and manager, but rheumatoid arthritis, for the most part, is there's certain chemicals in your body and in your blood that they attack. They call it the RA factor. They seem to attack joints, and they eat away at those joints, and you'll see people with advanced RA with deformed fingers and so forth. But normally when patients have multiple areas of joint pain, rheumatoid arthritis is a possibility. So while some of these biologicals, they call them, the drugs, can help with the pain, they are very, very strong, have a lot of side effects and so forth, but they do seem to work. But patients have been asking, what do you do to treat a local joint? What do you guys have? So something we've been doing and introducing for a while now is something called A2M. What is A2M? Well, we have talked about PRP, or platelet-rich plasma, on the call it the show, on these various webinars. And platelet-rich plasma is where we'll take the blood and isolate the platelets, which have tremendous healing factors when they're concentrated by sixfold. Well, A2M is also treatment that comes from the blood. But A2M, which is alpha-2 macrogammaglobulin, is actually made in your liver, and it also occurs naturally in your blood plasma. Now, A2M, these special proteins use specific binding sites to bind or neutralize bad enzymes in your joints that destroy cartilage. They're sometimes referred to as proteinases. Whenever anything has an ace at the end in the medical world, it means it's like digestive. It breaks things down. It doesn't build them up. But there's binding sites that we can trap these enzymes, and when you bind the A2M to these enzymes that degrade your joint, if we can do this naturally, we can kill off, or sometimes they call it suicide inhibition, to bind up these enzymes. It's like if you take a Tums when you have acid in your stomach, and the Tums binds and neutralizes the acid. That's what we're trying to do. We're trying to neutralize these bad chemicals in your joint. Now, A2M is very specifically prepared from your blood, and it's got to be it takes about 3 times the amount of time as preparing platelet treatments, because you're really isolating this certain protein. And it's very simple for the patient. It's complex for us. But, when it comes to rheumatoid in particular, there's a lot of interest in A2M and how it focuses on inhibiting these proteinases that are also called, the fancy term, matrix metalloproteinases, MMPs. So a lot of these proteinases, they basically degrade collagen, and collagen is the main component of cartilage. Brad, as you know, that's what arthritis is, the degradation of cartilage, because it begins to get eaten away. And so this is the crucial factor that we have to attack when we're trying to slow down or get arthritis feeling better, particularly in both types of arthritis, but even more so in rheumatoid arthritis. So what we want to do then, obviously, we want to turn a natural occurring protein that can obstruct or bind these actions of the degradatory, where they're degrading enzymes, so we can bind them and hopefully slow down the disease. So medical science is pursuing this with A2M therapy, and we've started to apply it as is appropriate. Another name for A2M, not to get fancy, is a cytokine, because when you guys start to read about this, if you get interested in it, you read all this fancy stuff. And a cytokine is something that's secreted by the immune system, and therefore it has effects on the other cells in your body. That's what the A2M concentrate does. And maybe, so more simply, A2M can be thought of as a good guy for rheumatoid arthritis problems, where the proteinases are the bad guys. These proteinases, again, are degenerating and eating away at the cartilage. And this is no laughing matter when it comes to RA. And these patients are in serious, serious pain, and their joints become immobile. There's chronic inflammation, and left alone, these proteinases will go on to just run rampant through your system and really destroy the joints. Now, opposite to a bad joint from RA, you can have healthy joints, and they have high levels of the A2M naturally. So if there now is a way where we could concentrate A2M from somewhere else and then place it precisely where it needs to be in that joint, well, then we have a ball game. And this is where A2M comes in. The idea is to slow the progression of the rheumatoid arthritis, where conventional medications go throughout your whole body and try to fight this off. This is a very specific. In other words, if it's your bad shoulder or it's in your elbow or your knee, we can place under fluoroscopic imaging, as we've talked about in other meetings that you and I have had, very specifically place the A2M molecules right in there to hopefully get you feeling better and slow down the RA. This is some of the newest stuff that's out. There's little wonder then that this new discovery of A2M, which, by the way, there was a orthopedic surgeon, Dr. Scuderi, who was injured horribly in an auto accident, and he was in pain dramatically without any relief and actually quit practicing medicine, and he started working as a researcher, and he's been very, very proficient and out in front of this whole world. But it's little wonder that this discovery has got a lot of excitement, and we started to introduce it because patients started to ask us about it. And now this is part of our latest arsenal against the different types of arthritis. So if someone's told you have RA and that's the reason you have pain, then this is something you might want to start reading about. We have packets in the office that we can send you as well. We do have our famous cost-free screening program. You're welcome to take advantage of that. Brad, I think you'll pop up a number in a moment. And this has become a really exciting part of our practice, and it's brought a lot of interest to our attention.
Yeah, I'm putting a number up on the screen here that they can call and they can speak with an expert to, if they want information, if they have questions, or if they even want to come in and see and speak with you guys personally. It's really cool stuff. Medicine advances so fast, and doctors, they really have to be on the cutting edge, correct?
Right. I would agree. And since we see so much of this, up to about a year ago, patients would come in with RA. And, by the way, I forgot to mention, there's a lot of patients with rheumatoid arthritis, unfortunately for them. My heart bleeds when I have met with these patients. They also have overlapping general arthritis. So sometimes they actually feel a lot better from the lubricants and the other treatments offered. But now that we have something more specific, and it's working in a majority of cases, it's gotten really exciting, and it's rewarding to finally have something for these patients. These things don't kill anybody. They're not lethal, but it makes your life really miserable. If you've ever met anyone with RA, it is absolutely a debilitating disorder, and it really affects your general ability to live a normal life. So hopefully the constant research and rollout of these things. And by the way, we've also mentioned this is part of the world called regenerative medicine, also known as autologous tissue transfer. That means, Brad, you're taking tissue from one area of the body, and without manipulating it dramatically, just isolating and concentrating certain parts of the blood or the stem cells from fat or bone marrow, you're then reintroducing it to heal. You're taking concentrations of what's in your body already. So it makes it very safe to use. I mean, it's your own tissue. This is not stuff we buy off the shelf. It's not cord blood from a baby. It's not placenta. It's your own cells. So you're not going to have some sort of immune reaction to it. And so it makes it safe and it's effective. And that's why these are great things that are starting to be introduced to our world.
Yeah, it's cool. And just to be clear here, you're not talking about this as being a cure for RA, correct?
No, these things, all of these issues, once you have RA, it's usually genetic. You're born with it. And so once you have it, the best that we can do is try to manage it. All of these things, the lubricants for osteoarthritis, these A2M treatments, this is a way to manage it. And when these really start to flare up, there's treatments that are safe, easy, and natural to do. But erasing rheumatoid arthritis is something we'll keep working on. But it's just a chemical that your body keeps spitting out. And unfortunately, all you can do is try to ward off the effects. Or like we talked about, basically you want to neutralize those effects and get the joint as healthy as you can. That also would bring up a fact of when do you start this when you have RA? Well, if you've been diagnosed with RA and you're starting to have some symptoms, it's a good idea to maybe chat with somebody about the condition, because the longer you let this degrade, the more damage it has. And so it's almost impossible to regenerate completely destroyed joint surfaces. But if we can prevent that or slow it down, then we've got an interesting ballgame. And I think that's what your question was.
Too. I know quite a few people that suffer with RA, and they've been through the mill. You know, they've been around and they've tried treatments and stuff. And what I keep hearing is that they're frustrated, that they're in a lot of pain. It affects their lives, and they get to the point where they believe there's nothing they can do. They believe there's no treatments that can help them, and they give up hope. Yeah. What would you say to them?
Well, I think that A2M provides new hope. You know, these A2M treatments provides new hope combined with other treatments, and that there's nothing in the medical world, and again, you and I have chatted about this at length in the past, there's nothing in the medical world that works 100% of the time in 100% of the cases. In fact, we had a gentleman come in the other day who came in after about 14 months and had his knees treated with lubricants, and he did very well. In fact, when he was asked, he said, yeah, I felt 75% better. But oddly, he was very disappointed that he didn't feel 100% better, which is really unusual. 75% better is wonderful. It's clinically significant, and it lasted him for more than a year. Interestingly, this man happened to be 79 years old, and he didn't respond to anything in the past. So I think the exciting thing is there's things that can work, that you can try. Nothing is 100% successful. It's not going to wipe out 100% of your RA. But if you can manage that discomfort and you can possibly slow down the deterioration ravaging your joints from RA, then this becomes really exciting and just something to look at. And you have to have a chat with a physician. And of course, we offer special no-cost evaluations so you can find out. We don't want anyone spending lots of hard-earned money just to find out whether or not they are a candidate. One of our physicians will ask you lots of questions, closely examine the areas hurting. If A2M or another treatment is appropriate, they'll discuss it with you. If it's not or they can't help, they'll refer you. But this is the way you can find out. There's absolutely no cost out of pocket. There's no obligation. You ask the doctors lots of questions, and you can proceed exactly as you'd like after that. So it's very thorough, but the whole thing has its own casualness, and it's very comfortable to have an evaluation with us.
Wonderful stuff that the advancements that keep coming down the pipeline, and you guys offer the ability for patients to come in to speak with experts to get their questions answered for free. So I'm putting up a number on the screen here. If anyone suffers RA, give them a call. They can specifically ask for Alex, I believe,
or if I'm not available, they can just say, I was listening to something, a webinar, or got your number, and I want to schedule for a no-cost screening. And so you don't have to talk to me. I'm happy to pick up the phone if I'm available, but you can talk to anyone about the screening. If you have any specific questions for me, you can, of course, ask for me personally. I'm very busy, but I will call you back normally within a period of a business day.
Cool. So here's the number, and give these guys a call. It's worth a shot. They'll talk to you. They're not going to try to sell you stuff, just like you spoke about today. It's information they want to get out the public, and they want the people suffering here to really understand that there is hope out there. Anything else?
No, I think that wraps it up. Hopefully, if anybody's interested, get some more information. If you just want a packet, you're not ready for an evaluation, call for a packet. Specifically say you want the rheumatoid arthritis packet. We'll send it out to you as soon as we can. We can email it if need be, or in fact, take the leap and come in for an evaluation.
Great stuff, right. and thanks a lot. And you're on here. We try to do these once every week or two. So check us out some more. I'll talk to you later.
Bye
bye.
Okay.